Have you recently had stem cell injections, or you're considering stem cell injections and you're wondering, do I really need to do anything afterwards? Isn't the recovery pretty straightforward? That's what I'm going to be covering inside this video, the top 3 myths of stem cell recovery. My name is Dr. Chris Garcia. I'm a leading expert in stem cell recovery, and I help people just like you recover safely, faster, so they can get back to that active life that they once had before the stem cells. Now, when we look at what stem cell recovery is, it is a process in which after injections, you go through and have a systematic approach to recover properly. Well, the top 3 myths are associated with this recovery process. If you've had stem cell injections or you're considering it, you might have put years, months, weeks into deciding, is this a procedure for you? You probably did stem cell injections because of chronic pain, things that you were frustrated with, and you just want to get your life back. So you put a lot of research, rightfully so, into deciding if this was a thing for you. The challenge becomes a lot of people don't put any attention or research into, well, that's great that I get them done, but what happens afterwards? What do I need to do? Is it important? And so here are the top 3 myths that go wrong inside this recovery process. The first one is, well, I can do it on my own. I don't need anyone. I don't need a recovery process. I'll just do it on my own. Whether you were a pro athlete in the past, you were a collegiate athlete in the past, or you work in fitness and healthcare, I can tell you confidently that this is the farthest thing from the truth. And that's because after working with hundreds of stem cell clients all over the world, I can tell you that we have helped physical therapists, physicians, we have helped people who have advanced degrees in medicine who still need help. And that is purely because of the complexity of the stem cell recovery process. This is not something that you would do on your own. And what I can tell you is, what happens, worst case scenario, is you put all this money, time, and investment into deciding if stem cell injections are the right thing for your health. You put in a lot of that time, energy, and money into it. What you can do is you can delay your results, or even worse, mess up your results, and you don't want to do that. So the first myth is, I can do it on my own and I don't need anyone to help me along this process. That's the first one. Number 2, it's pretty straightforward. Or it's easy, it'll be fine. It's a straightforward process. I can do that. Now, it is not straightforward. It's actually very complex, especially if you get injections, or stem cells through IV, intravenous, meaning they're now going to go into your entire body instead of just locally. Some people get them just at the injection sites, your low back, your knee, your hips, your neck. Some people will also include through IV, so that enters the entire body. What that does is it creates an inflammation process that you have probably never seen in your life, and it feels like a flu. It feels like something just hit you. You got hit by a bus. And this can take weeks to months to recover from. And if you go out and try and do these things on your own, and you take it as it's straightforward, I'll just do it systematically on my own, that's going to be hard to do because you don't know what's normal. And then you start thinking, well, am I crazy? Everyone else seems to be recovering faster. And if people are recovering faster, it's because they understand what to do, when to do it, and how to do it. And that's creating the structure inside the recovery process. So if the first myth was, I can do it on my own, I don't need anybody else, we know that's incorrect, because you're going to need support. And if the second myth is, it's straightforward and it's easy, I can tell you that is far from the truth, because it is not easy. After helping people all over the world, we see challenges along the way. And we use science and your own tissue healing and your own reports on how you're feeling to help navigate. Well, at this time point, you should be here. But I would say is, drop your activity level, get into a pool or stay on the bike, start hiking a little bit more. You can now start going to the gym. It's not straightforward. There's an estimated timeline, or time points and critical time points and milestones that you should be achieving. But just because you don't achieve them, it's okay. We can work around that. But what you don't want to do is assume it's just going to be straightforward. It is not a straight line by any means. Now, if you said, this is easy, I can do it on my own, and it's straightforward, you've already put yourself in a bad position. Don't do that. Now that you're understanding that there's a systematic approach to this, and there are milestones, the last one is, you have to understand, people start thinking, well, I can do it on my own, it's going to be straightforward, and you know what, I'll ask my friend or the person that I've used before to help me with this recovery process. You might have been in physical therapy in the past. You might have thought, well, I've worked with Dan, my physical therapist, or Mary, my physical therapist, and they've helped me with that, or my chiropractor, or my acupuncturist, or my massage therapist. They can help me with this recovery process. I thought I could do it on my own, and it was going to be straightforward. So now I'll just use somebody locally, somebody that I've used in the past. Well, the challenge is that stem cell injections and recovery has only been around for a certain portion of time. And because of that, because it's new or novel, there's not a standardized approach to recovering properly with these types of cases. And the challenge with that is, if you take a traditional rehabilitation or physical therapy approach, it's going to be too aggressive, because stem cells require a lot of recovery and patience, and you actually go about 50% slower in the recovery process, probably in those first 12 weeks. Now, if you've been used to a back surgery or knee pain, you know in those first 12 weeks, you started to work on your range of motion and flexibility and getting you stronger and back in the gym within 3 months. Well, that is going to be the opposite. Those first 12 weeks are super slow, and there's a huge ramp up time at the week 12. So what that changes for you is, if you were to get injections and go see your friend or your old physical therapist, and you used their approach, which they've never worked with stem cell clients before, you're now going to have a significant increase in activity, because they're only doing what they're used to. It's not their fault. They don't know how to manage these individuals, because you thought, I'll just use a friend of mine or somebody I've used in the past. You're going to have a huge increase in activity, which your stem cells are going to fight you back, and then you're going to have a huge dip in progress. Then this is what happens. The physical therapist doesn't know what to do. You don't know what to do, so you just start going slow. So now you go high and fast, you come down, don't know what to do, so you go here, you're feeling better, so you do a huge ramp, and then you come right back down. And you have this wavering, escalating concerns, fears, flare-ups, and then you get lost right around that 3 or 4 month mark. So the first myth was, I could do this on my own. Not true. Number 2, this is going to be straightforward and easy. Not true. And number 3, well, I'll just use my friend or my old physical therapist. Not true. This leads to flare-ups and inconsistent results, delayed results, or no results. So if you're looking to maximize your results in a safely and timely manner, so you can get back to that life that you want to be able to get back to, number 1, I would never have you do it alone. Don't do this. You need to partner with somebody to help you along this process. And number 2, it's not straightforward and it's not easy, and you need to understand that before you go into the recovery process. And number 3, don't just use somebody cheap or local or familiar, because this investment of time and money is very precious, and you need to do it right from the very beginning. Or if you've already had those challenges, get back onto something more structured. If you're looking for help with local or virtual consultants to be able to help you with this recovery process, my team at the Stem Cell Recovery Experts can help you, put you on that path. And if you're working with a local physical therapist, we can help you along that process. Our goal is to be able to help people who are recovering from stem cells, to put them on the right path. Because we've been able to help so many clients, we know what it takes, we know the exact structure, we know your fears. You're not crazy. Yes, you're trying to do it on your own, but it's not the right thing to do. Or maybe you've had those flare-ups and we get it, and it feels like no one is on the right path. Everyone's lost and don't know what to do. If you've ever felt like that, we get it, we understand that. Because we see stem cell clients all day, all week, all month, all year. We understand that. We want to be able to put you in the right direction. So if you're looking for help, whether you're looking for more information, pointing you in the right direction, are you on the right path, or I'm feeling great, what do I need to do to stay there? We'd be happy to help. You can reach out to my team at any of the contact information below, but ultimately we're excited to put you back on that right path, keep you on the right path so you can live that life that you once enjoyed. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.